We've got 300 million people worldwide with depression, depressive disorders. And it's the leading cause of disability currently in the world. So that's pretty big. That we have a mental health disorder being the leading cause of disability. Obviously, something's gone wrong here in humanity that's happening that we want to address. And the World Health Organization now has predicted, and this was a while ago, that by 2030, it's going to be the world's largest global burden of disease, depression itself. And the Anxiety and Depression Organization America is saying about roughly, from their research, roughly 19% of the United States experience anxiety disorders. So we're facing a lot of challenging numbers here to deal with and a lot of challenging suffering, but we can definitely address it. And that's what we're all about here at IPI, and about informing others about ways to really get to the bottom of what's going on with this growing problem, what's going on with mental illness. Conventional psychiatry, why are our efforts not working? We want to ask that question, right? Some of our efforts are, but some aren't. So what's going on here? Well, one thing happening is that in conventional psychiatry, there's a lot of pathology. We pathologize disorders based on symptom clusters. Now that's great for knowing which medications to give somebody, which medicines, and other interventions, but it can result in a lot of highly stigmatizing issues. So some tenets of integrative psychiatry, just so you get a feel of integrative psychiatry and what are the basic principles there. It's use less pharm. Again, we're not against, integrative psychiatrists are not against pharmaceuticals. It's just we use less of them because they have side effects and a lot of toxicity, and they are often not able to treat root causes. Another tenet is symptoms are not actually root causes, they're signals, why the person is having fatigue, why they're having sadness, why they're having low motivation. We want to get to the bottom of where do these come from.
The first point we want to make is that the body's natural immune system is in balance and in health when inflammatory signals are able to flare up. In the case of infection, acute infection, we need to have inflammation to take care of the infection and clear it. But we also need to be able to put out the fire of inflammation pretty quickly after we have solved the problem of the virus or the bacteria or the parasite.
One solution is integrative psychiatry, because it takes a very different approach. The approach of integrative psychiatry is really all about looking for root causes of mental illness. And so there's a number of ways to do that. So we define integrative psychiatry at IPI as the diagnosis and effective treatment of root causes of mental illness, predominantly using CAM methods, because CAM methods are actually there's a lot of CAM methods out there that are very usable for treating root causes. And we also use conventional interventions, pharmacology, pharmaceuticals, for instance, for certain things. Now, by effectively treating the root causes of mental illness, that's where it's really possible to really help patients get well so they don't have recurrence of symptoms, and also to help people who are treatment resistant. And this is where we can really put a dent in this global mental health crisis that we're facing.